Hi, my name is Alina Root. I'm a student nurse with Cedar Crest College. I'm doing my evidence-based poster. My topic is aromatherapy and using the essential oil lavender in acute care settings to help reduce anxiety. I became interested in this because at work we do use aromatherapy, and I was just kind of curious to see what kind of merit it actually has. My PICO question is, in patients in acute care settings, does the use of aromatherapy with the essential oil lavender compared to standard care alone have positive outcomes related to anxiety? The significance of this is that nurses are responsible for treating, managing pain, nausea, and anxiety. There is a large proportion of the population that suffers from mental illness. 18% of the population in the United States suffers from anxiety. And those with mental illness have a decreased adherence to medication and increased risk for adverse effects. Some of the objective symptoms of anxiety include increased heart rate, inability to focus, elevated blood pressure, and sweating. Some of the subjective symptoms include irritability, fatigue, and restlessness. The process of my literature search included using the databases CINAHL and Google Scholar. I limited the search to the years from 2009 to present. I also included limiters for studies found in the United States only. And what else did I use? Full text article and academic journals. I used keyword searches using lavender, essential oils, and anxiety, and I found the top 3 studies, those of which included Braden et al., which was a prospective experimental pre- and post-study that looked at surgical patients, pre-surgical patients. They did an interview just before entering the pre-surgical suite and then just before the OR. And they found those in the Lavender group, which is a hybrid of lavender, which they found was more effective than lavender itself. It did have the lowest scores overall and the lowest scores entering the OR. In this study, Johnson et al., it was a retrospective observational study. They were testing the effectiveness of an intervention for aromatherapy by the nurses. And they used they tested, the main oils that they tested included lavender, marjoram, ginger, and something else. But they did find those in the lab that did use lavender, and also marjoram did have the lowest anxiety scores. And the Lytle et al. Study, it was a randomized controlled pilot study. In that study, they tested the effectiveness of inhaled lavender. They monitor that by doing patient vital signs, and they also had the patients do a sleep questionnaire at the end of the study. They found those in the lavender control group did have the lowest blood pressure scores, and they also had the highest sleep scores, or meaning that they had the best sleep. Recommendations for this study including to educate or train the nurses in the appropriate oils, essential oils that they can use, and the different methods of use, as well as educating the patients of the benefits and being able to use them appropriately in different scenarios. Also to educate on the history of essential oils, the different plants that can be used for essential oils, and also electronic medical record documentation, just so you can get overall confidence in using essential oils and aromatherapy within the hospital setting. Also, recommendations include broadening the scope of the patients in the studies, and also to include more diverse populations, and also to do research versus direct versus indirect methods. And the results concluded that aromatherapy is an ideal niche to include the holistic trend in nursing, as well as increasing patient satisfaction. Aromatherapy can be used to combat anxiety exacerbation that occurs during stress and sickness. It is a low risk, and it is also a nurse-driven intervention, allowing for greater autonomy. It can be provided to a large demographic, and it is again low risk, which means that it has the maximum patient satisfaction. So thank you very much for your time. I look forward to your comments, and I hope you enjoyed my presentation.